Avian influenza, commonly known as bird flu, is a serious concern for global health. This infectious disease primarily affects birds. However, certain strains, particularly H5N1, have crossed the species barrier and can infect humans. The current outbreak of H5N1 avian influenza represents a significant threat to both human and animal health worldwide. This essay will delve into the complexities of this avian flu pandemic, highlighting its impact and offering crucial safety precautions. Avian influenza viruses are classified as either low pathogenic or highly pathogenic based on their ability to cause disease in poultry. Low pathogenic avian influenza viruses typically cause mild or no symptoms in birds. However, highly pathogenic avian influenza viruses, such as H5N1, can cause severe illness and death in poultry, often with mortality rates approaching 100%. The H5N1 virus spreads through flocks of birds, both wild and domestic. Wild birds, particularly waterfowl, can carry the virus without showing symptoms, acting as silent carriers. Domesticated birds, such as chickens, turkeys, and ducks, are highly susceptible to H5N1 infection. The virus spreads through direct contact with infected birds, their saliva, nasal secretions, and feces. Additionally, contaminated surfaces, equipment, feed, and water can also transmit the virus. The transmission of H5N1 from birds to humans is a complex process. The virus primarily spreads through direct contact with infected birds or contaminated environments. However, human-to-human transmission is rare and typically limited to close contact with infected individuals. The concern with H5N1 lies in its potential to mutate into a form that can easily spread between humans, potentially triggering a global pandemic. The global reach of H5N1 is alarming. The virus has been detected on multiple continents, impacting both wild bird populations and poultry farms. The widespread nature of the virus underscores the interconnectedness of global health and the importance of international collaboration in monitoring and controlling outbreaks. The current H5N1 avian influenza outbreak has reached pandemic proportions, impacting countries across the globe. The virus has been detected in various bird species, including wild birds, backyard poultry, and commercial poultry flocks. The World Organization for Animal Health reports that H5N1 has been detected in over 500 animal species globally, highlighting the widespread nature of the virus. The impact of H5N1 on the poultry industry has been devastating. Outbreaks in commercial poultry farms have led to the culling of millions of birds to prevent further spread. The economic consequences are significant, with losses in poultry production, trade disruptions, and rising prices for poultry products. Governments and international organizations are working together to control the outbreak, implement surveillance measures, and provide support to affected countries. Human infections with H5N1 have also been reported, although they remain relatively rare. Most human cases have been linked to close contact with infected birds, particularly poultry. Symptoms of H5N1 infection in humans can range from mild respiratory illness to severe pneumonia, acute respiratory distress syndrome, and even death. The World Health Organization is closely monitoring the situation, assessing the risk of human-to-human transmission, and developing pandemic preparedness plans. The H5N1 virus, like many viruses, is constantly evolving. New variants of the virus emerge through mutations, and some of these variants may pose a greater threat to animal and human health. Scientists are particularly concerned about variants that show increased virulence, transmissibility, or resistance to antiviral drugs. One concerning aspect of the current outbreak is the emergence of H5N1 variants that can infect mammals more efficiently. Cases of H5N1 have been reported in various mammals, including mink, foxes, and sea lions. The ability of the virus to infect a wider range of mammals raises concerns about its potential to adapt further and potentially increase the risk of human infection. Genetic analysis of circulating H5N1 viruses is crucial for understanding the evolution of the virus, tracking the emergence of new variants, and informing the development of effective vaccines and antiviral treatments. International collaboration and data sharing among researchers are essential for staying ahead of the evolving threat of H5N1. The impact of H5N1 extends beyond the poultry industry, affecting biodiversity and global economies. The virus has caused die-offs in wild bird populations, including endangered species. The loss of these birds can disrupt ecosystems, impact food chains, and have cascading effects on the environment. The economic consequences of H5N1 are far-reaching. The culling of poultry flocks leads to losses for farmers, disruptions in the food supply chain, and increased prices for consumers. The cost of controlling outbreaks, implementing surveillance measures, and developing vaccines also puts a strain on national economies. International trade in poultry products can be affected by H5N1 outbreaks. Countries may impose trade restrictions on poultry imports from affected regions, leading to economic losses for exporting countries. The interconnectedness of global trade highlights the need for international cooperation in managing and preventing the spread of avian influenza. The impact of H5N1 on livelihoods, particularly in developing countries where poultry farming is a significant source of income and food security, can be devastating. International organizations and governments are working to provide support to affected communities, but the long-term consequences of H5N1 outbreaks can be severe. Protecting yourself and your community from avian influenza requires a combination of personal precautions and collective action. While the risk of H5N1 infection in humans remains relatively low, it's essential to be aware of the risks and take steps to minimize exposure. One of the most effective ways to prevent avian influenza infection is to avoid contact with birds, particularly poultry and wild birds. If you must handle birds, wear appropriate personal protective equipment including gloves and a mask. Wash your hands thoroughly with soap and water after any contact with birds or their environments. Ensure that poultry products including eggs and meat are thoroughly cooked to an internal temperature of 165 degrees Fahrenheit or 74 degrees Celsius to kill any potential virus. Avoid consuming raw or undercooked poultry products. Practice good food safety hygiene in the kitchen, keeping raw poultry separate from other foods and disinfecting surfaces that have come into contact with raw poultry. Stay informed about avian influenza activity in your area. Follow the guidance of public health authorities and take any recommended precautions. If you experience any flu-like symptoms, especially after contact with birds, seek medical attention immediately and inform your healthcare provider of your potential exposure. Section 6. Safeguarding our animal companions. Precautions for pet owners. Pet owners, particularly those with birds as pets, need to be extra vigilant during avian influenza outbreaks. Birds, including pet birds, can become infected with H5N1 and potentially transmit the virus to humans. Protect your pets and yourself by following these essential precautions. Keep your pet birds indoors and prevent contact with wild birds. Don't allow your pet birds to roam freely outdoors where they may come into contact with infected birds or contaminated environments. Provide your pet birds with fresh food and water daily, ensuring that the food and water sources are clean and protected from wild birds. If you have other pets, such as cats or dogs, keep them separated from your pet birds. While there have been limited reports of H5N1 infection in cats and dogs, it's best to err on the side of caution and minimize contact between different species. If you suspect your pet bird may be sick, contact your veterinarian immediately. Section 7 on the front lines: essential steps for high-risk groups. Certain groups of people such as poultry workers, veterinarians, and wildlife biologists are at higher risk of exposure to avian influenza. These individuals work closely with birds and may come into contact with infected animals or contaminated environments. Implementing strict biosecurity measures is crucial for protecting these high-risk groups. Poultry workers should wear appropriate personal protective equipment, including coveralls, gloves, masks, and eye protection, at all times while handling birds or working in poultry houses. Regular hand washing and disinfection of equipment and surfaces are essential. Workers should shower and change clothes before leaving the farm to prevent the spread of the virus outside the facility. Veterinarians handling birds should follow strict biosecurity protocols, including wearing protective clothing, disinfecting equipment, and isolating potentially infected animals. Wildlife biologists working with wild birds should also take precautions, such as wearing gloves and masks when handling birds or collecting samples. Early detection of avian influenza in poultry flocks is crucial for controlling outbreaks. Farmers should monitor their birds closely for any signs of illness, such as decreased egg production, respiratory distress, or sudden death. Any suspected cases of avian influenza should be reported to the appropriate authorities immediately. Section 8. The power of knowledge. Research and monitoring in the fight against avian flu. Research and surveillance play a vital role in understanding, controlling, and preventing avian influenza outbreaks. Scientists around the world are working tirelessly to monitor the virus, track its evolution, and develop effective vaccines and antiviral treatments. Surveillance programs are essential for detecting avian influenza outbreaks early on. These programs involve monitoring wild bird populations, testing poultry flocks, and investigating any suspected cases of avian influenza in animals or humans. Early detection allows for rapid response measures, such as culling infected flocks and implementing quarantine zones to prevent the further spread of the virus. Research into avian influenza focuses on various aspects, including understanding the virus's biology, developing diagnostic tools, creating effective vaccines, and identifying potential antiviral therapies. Scientists are also working to better understand the factors that contribute to the emergence and spread of avian influenza viruses, such as bird migration patterns and agricultural practices. International collaboration and data sharing are crucial for effective avian influenza research and surveillance. Sharing information about outbreaks, virus strains, and research findings allows the global community to respond to the threat collectively. Organizations such as the WHO and the WOA play a vital role in coordinating international efforts to combat avian influenza. Section 9. Staying ahead of the curve. A call to action. Avian influenza, particularly the H5N1 virus, poses a significant threat to global health, animal welfare, and economic stability. Protecting ourselves and our communities requires a multifaceted approach involving personal responsibility, public health measures, and scientific advancements. Staying informed about avian influenza is crucial. Follow reliable sources of information such as the WHO, the WOA, and your local public health authorities to stay updated on the latest developments, recommendations, and precautions. Share accurate information with your family, friends, and community to raise awareness about the importance of avian influenza prevention. Support research efforts aimed at understanding, controlling, and preventing avian influenza. Funding for research into vaccines, antiviral treatments, and surveillance programs is essential for staying ahead of the evolving threat of this virus. By working together, we can mitigate the impact of avian influenza and protect the health of both humans and animals. Avian influenza is a reminder of the interconnectedness of human, animal, and environmental health. By embracing a One Health approach, which recognizes the interdependence of these three domains, we can develop comprehensive strategies to address complex health challenges, such as avian influenza, and prevent future pandemics.